Hi, I'm Joo Teoh, Perth obstetrician, gynecologist, and fertility specialist. The title of this video is called From the Moment My Baby is Born, a quick guide for new mums. In the last video, we visited on a few topics in the antenatal period. Now, this video is focusing on another very important timing in maternity care. It is in the postnatal period after the baby is born. We will be discussing on a few topics and also points. Let's move on to the first point. The first point is about delayed cord clamping, DCC. Now, in the last video, I talked about how I would strongly recommend DCC in most cases. It has been scientifically proven to improve the health of most term and preterm babies. There may be certain circumstances that DCC is not suitable. For example, when a pediatrician needs to attend to the baby immediately. DCC can also reduce the use of for cord blood banking, resulting in fewer stem cells being collected if you choose to do stem cells banking. Apart from that, for most deliveries, DCC is recommended. Next topic I'm going to discuss about skin to skin after delivery. Early skin to skin is encouraged, and it has been shown to help to establish breastfeeding and to also develop bonding between the baby and mother. The long-lasting effect of its benefit on the child's physical and emotional development may be noticeable even up to many years later. Immediate skin to skin may be possible in a cesarean section when the mom is awake. Sometimes skin to skin has to be delayed when the baby needs more attention from the pediatrician. The third point is about pain control. After deliveries, women should have adequate pain control measures to feel comfortable. Most women would need to take at least some form of pain control tablets. Many of these tablets are safe for breastfeeding. The amount of pain control needed after childbirth is very different between women. Do not hesitate to discuss with the doctors and midwives about the right amount you need. Another point is about wound care. Now, a cesarean section wound can be left with the dressing on for a few days. If the dressing gets wet, it will need to be changed. The wounds from an episiotomy or vaginal tear usually do not have any dressing on. For all wounds, wash with clean water when showering. Avoid putting soap or any shower gel directly onto the wound. Baths or even salt baths should be avoided. Ensure the wound is adequately dried after washing, and report any redness or discharge on the surrounding skin to the doctor or midwife, as there may be signs of the infection. An infected wound can also produce a foul smelling. The next point I'm going to discuss is about debriefing. Now, what is debriefing? Debriefing means discussing the events of the delivery, usually with the doctor or midwife involved in that timing of the delivery. So sometimes the events surrounding the time of delivery may be happening very quickly. For example, in an emergency, there'll be lots of rushing and people sometimes running around even. So after that, if you have a debriefing, that would allow you to ask questions and understand the sequence of events that happened during the delivery. And for many moms, debriefing helps them to feel more reassured, to understand what happened, and for them to feel more in control of their emotions. The next point, let's move on, is about bleeding. Normally, the womb contracts and shrinks in size immediately after the delivery of the baby and placenta, the afterbirth. And the contractions compresses on the blood vessels in the womb, and thus reducing the bleeding from the childbirth. Breastfeeding helps to enhance the contraction of the womb because of the releasing of the hormones oxytocin from breastfeeding. The bleeding after birth is called lochia. In the first few hours following the birth of your child, you may have to change your soiled maternity pads every few hours. Bleeding that is very heavy, filling up or soaking up pads quickly is abnormal and has to be dealt with immediately, as it is a so-called postpartum hemorrhage, where the bleeding sometimes can be very heavy. Apart from that, if things are normal, sometimes you may still pass moderate sized clots, like the size of a small orange. The amount of bleeding should reduce further after the first few hours or days. The color should change from bright red to brown over the first few weeks, and the light lochia can continue on for a few weeks. Usually it stops by 12 weeks or even way before after the delivery. So each woman is different. So I've got patients that bleeding almost stop after a few, like 4 weeks. But some patients after 6-7 weeks they're still having light bleeding, which is normal. So if you have any concern, please discuss with your friendly obstetrician or midwife at any time if you think the bleeding is heavier than usual. Now, the next point I'm going to discuss is about exercising after delivery. After delivery, your scar will need time to heal, and all the ligaments and joints are still lax for even up to 3 months after the birth of the baby. So moms should take time for the body to adjust before going back to high impact exercises or vigorous stretching. Start with light exercise and building up the intensity slowly over time when you know your body can take it. Recommended postnatal exercises, which include brisk walking, swimming, aqua aerobics, yoga, pilates, low impact aerobic workouts, like weight training and cycling. It is beneficial to start pelvic floor exercise as soon as you're ready for the delivery. Now, pelvic floor exercise helps to strengthen the muscle and enhances the healing from the delivery. This is important to prevent or treat urine leakage or incontinence, as well as to prevent pelvic floor prolapse. You should be able to find information on pelvic floor exercise from your hospital or from reliable web pages, but there are physiotherapists who are very experienced and they have a strong focus on pelvic floor exercise. They'll be more than happy to give advice and guidance and ensure that we use the correct muscle in the training of pelvic floor exercise. It's very important to use the right muscle to train the pelvic floor, make sure it's nice and strong. But we have to think of it as going to the gym. It takes time, at least a few weeks, and effort to strengthen the muscle. So we have to be determined and persistent in pelvic floor exercise to have the greatest positive effect. The last point I'll talk about is diet after delivery. Now, the healthy pregnancy diet is still beneficial to your body even after the delivery. At this stage, your body needs nutritious food that is rich in iron, calcium, and protein to help with the healing and also the production of milk for moms who are breastfeeding. After the delivery, there's no need to worry about the risk of listeriosis directly affecting the baby from your breastfeed. So the risk is fairly small. This is good news for those who are craving for soft cheeses. With adequate diet and exercise, the weight gained during pregnancy is usually shed over 6 to 12 months. A loss of up to half a kilo per week is sufficient, especially during breastfeeding. I would avoid crash diet or losing too much weight during this time, as your body still needs the nutrient to heal up nicely. On the other hand, moms, we have to be careful not to carry this extra weight for too long or into another pregnancy. And yes, this makes it much harder to return to a healthy weight. Right, I think this is enough for this time. See you in the next video. Bye.